Alzheimer's disease takes a terrible toll, robbing patients of their memory, their mind, and ultimately their life. A new report says it will cost the U.S. $200 billion, $200 billion with a B this year alone. More than 5 million Americans now have Alzheimer's.
Dr. Gary Small, director of the UCLA Longevity Center, has a new plan to fight it. His book is called The Alzheimer's Prevention Program, Keep Your Brain Healthy for the Rest of Your Life. Good morning.
Good morning.
Can we just say, Charlie, before you start, you're the only one who has sat at this table and said, boy, that's a beautiful brain scan. Have you ever heard those words, Charlie, sitting?
That was the first. I hadn't even looked over that, so I didn't know what he was talking about. I don't have a brain scan here, so I thought there was something I didn't know. So obviously the idea that we can do something to prevent Alzheimer's is good news for lots of people because the overwhelming number of statistics we see because we're living longer, and secondly, the amount of money that's being sent to try to find some kind of cure and or prevention.
Well, we have 80 million baby boomers right now who just last year started turning 65. So we have a wave of people who are at risk. Age is the single greatest risk factor, and people are concerned about their everyday memory slips, what they can do about it. If we just took 1% of the $200 billion we're spending each year, that would make a big difference. That would be $2 billion for Alzheimer's research. Right now we're spending $6 billion on cancer research. We really need to invest more in research to find a cure. But while we're waiting for science to catch up, there is something we can do. Genetics accounts for only part of the risk for developing Alzheimer's disease. That means that non-genetic factors, brain-healthy lifestyles, decisions we make every day can have an impact on how our brains age and possibly delay the onset of symptoms.
So we should be doing what?
We should be doing physical exercise. We should be doing mental exercise. We need to eat a brain-healthy diet, manage our stress, and when we combine these strategies, the science tells us that there's a possibility we can delay the onset of symptoms, maybe 1, 2, 4 or more years. And for many people, that would mean never getting the symptoms in their lifetime.
But I mean, some people have said and argued that one of the tragedies of Alzheimer's is by the time you recognize you have it, it's too late to do anything to delay it.
Scientists are trying to develop treatments that will protect a healthy brain rather than try to repair brain cells once they've died. And that's our strategy at UCLA. Many people are using that strategy, and that's the strategy of the Alzheimer's Prevention Program, to engage in brain-healthy lifestyles to protect a healthy brain. So, you know, simple things like taking a brisk walk every day, 20, 30 minutes a day.
And most people can do that, but I'm more knocked out by the numbers that you brought, the millions and millions of dollars. Why does it cost so much?
You've got so many people. You have 5.4 million people with Alzheimer's disease in this country. You have another 10, 20 million with mild cognitive impairment who are at risk. And so caregivers have to take care of them. They use up more Medicare dollars. They're more likely to end up in the emergency room, not follow their medical illnesses. So there's lots of complications to the illness, and it means that we really have to be aggressive about this disease and do something about it.
It's great to see you. Thank you so much. This is good words and wise words for those people who face what many people think is an increasingly pervasive disease.
Hopefully we're close. Thank you, doctors.
Thank you.